Cervical cancer is preventable. However, experts say thousands of women each year in the U.S. are diagnosed with it, and many of them are minorities.
And News 8's multicultural reporter Katira Winfrey joins us now as we celebrate National Minority Health Month. Katira.
Phil and Brooke, doctors say there isn't anything particular in DNA of minority women that makes them more susceptible to cervical cancer. It often boils down to socioeconomic status. Poorer people tend to have less access to vital health services like yearly pelvic exams. The human papillomavirus, or HPV, is something any woman of any age can be exposed. If left unchecked, it can turn into cervical cancer.
Here in the United States, we maybe have about 14,000 cases a year. But again, in the world, there's over 500,000.
Dr. Tina Ayani is a gynecologic oncology surgeon at Franciscan Health. She says in the last 30 to 40 years, medicine has helped minimize cases of cervical cancer, but it's still a risk. In the U.S., although white women make up the majority of the female population, however, Hispanic and black women outrank them in cervical cancer cases. Asians and American Indians aren't far behind. But she says the reason isn't something found in a minority's DNA. Instead, it's skipping out on pelvic exams and pap smears, which identify infected cells.
For most women, this is not a cancer that you get exposed and it pops up within a year. That virus can be dormant. It kind of goes to sleep in your system. And it's not really clear what causes that virus to activate.
Having insurance and the ability to pay is also often a barrier for some to access pelvic exams. In other cases, Dr. Ayani says some may assume because they've reached a certain age, the threat is gone.
Even if you've had a hysterectomy in the past, even if you're not having any symptoms, that physical exam, pelvic exam every year is so important.
And not having insurance can often be a hurdle in getting those regular pelvic exams, but officials say state and county health departments have resources available for women who need them. I'll post links to resources inside this story on wishtv.com. Reporting in the studio, I'm Wish TV News 8's multicultural reporter, Katira Winfrey.